Hey everybody. Okay. This is, believe it's the fourth lecture of the public health section of this class. I'm going to focus on tribal epistemology. Um, and that's going to require me to take a bit of a tour through history so that we can understand what vaccinations are. Then I'm going to talk about a particular instance of denial of science called anti-vaccination, anti-vaxxers. It will lead me to some of the stuff that has popped up now with coronavirus. And then we'll wrap it all up with a final discussion of what I take to be a three-part series throughout this class, where we started off with discussing flat Earth, and then we discussed climate change denial, and now we're talking about um, anti-vaxxing and coronavirus denial, and just generally why and how we're at this position where people will deny science and the conclusions of science. It's going to seem less irrational after this, hopefully, than before, but it's still somewhat problematic, and it's problematic for society. And so it's important for us to take it seriously. So in the late 1700s, the first vaccination was developed. Here we have Edward Jenner endangering the child of one of his employees, James Phipps, who was 8 years old. We usually tell this story from Jenner's point of view about how smart he was, that he noticed that women who developed cowpox never developed smallpox. And so he thought, well, what we should do is rub the pus from cowpox on a patient. They would develop that ailment, and then they would be immune to smallpox later on. It's actually a brilliant thought and a brilliant observation. Turns out that the cowpox and the smallpox viruses are very closely related, so the body's immunity to one translates to an immunity to the other. That is not necessarily the case for most viruses, but smallpox was a lucky exception. He just decided to do it with a child who was a child of the person at his employ. That should remind you somewhat of our bioethics discussion. But that was the first vaccination. We didn't know what viruses were. We didn't know why vaccinations worked. But somehow the being infected with the less bad version, the cowpox, made you immune to the version that killed lots of people, smallpox. Throughout the 20th century, we developed more and more vaccines. Diphtheria, whooping cough, tetanus, polio, measles, mumps, rubella, hepatitis B, rotavirus. I'm forgetting what HIV is. And as you can see, like deaths by infectious disease, they seem like they're relatively constant after a drop, but keep in mind that the population has increased two or threefold, right? The population was 3 billion in 1969. So it is currently more than double that. So really the effective rate of vaccinations, of deaths due to infectious disease, has decreased. And when you look at the data in terms of who has died a century ago compared to recently, you could see that a lot of these things that were big causes of death that led to the life expectancy being several decades lower in the 1900s than it is now. A lot of that is due to advancements in sanitation, advancements in food, in and a good chunk of it is vaccinations. There were millions and millions of infectious disease cases in the 1900s, and now there are relatively few of them. And you can see that when you compare smallpox and diphtheria, for example, or polio, we've completely eradicated entire disease classes that destroyed a good number of people in certain regions in certain generations. Right? We have current sitting members of Congress that had polio. My brother, I believe, was in the last was born the last year that the United States still vaccinated against smallpox. So most of us aren't vaccinated for it because we're so comfortable that we've eradicated it in this country. Vaccination is one of the top public health achievements in the 20th century, and it's the kind of a achievement that we take for granted. Because most of us don't know people that have died from some of these infectious diseases, we don't take them as seriously as probably people did in other generations. It is true that there are adverse reactions to vaccines, right? There are people that have allergic reactions, there are people that get sick, and some people even die from receiving vaccinations. But the odds of that happening are extremely low. I mean, you're 100 times more likely to be struck by lightning than you are to die due to something going wrong because of a vaccination. And so we're at the point where we have quite a few vaccines in the schedule of childhood, right? So children have some innate resistance to diseases due to their mother's immune system for around the first 6 months of their lives. And then we start vaccinating them against diseases that we think that they will encounter. The idea being that they will develop a healthier immune system because of these vaccines. And they won't die, and these diseases won't proliferate throughout the country. Okay, so that's vaccinations. Let's talk about anti-vax. The people that think that vaccinations are too risky and that we should not vaccinate our children. Specifically, the one that's going to be the target here is the measles, mumps, and rubella vaccine, rubella being German measles. The measles vaccine was introduced in '63. Mumps and rubella vaccines were introduced after that, and they were lumped together into an MMR vaccine shortly thereafter. But as you can see, as we developed more and more vaccine coverage over the years, the number of cases of measles worldwide dropped by orders of magnitude. Across the United States, when the vaccine is introduced, you can see the case rate dropping to a bare whisper, especially around the 90s and 2000s. They've started popping back up again since the rise of the anti-vax movement. But thankfully, most people still choose to vaccinate their children with the MMR vaccine. Measles is one of the most contagious diseases. In fact, I used it as an example of a high-end contagious disease. And as I said in a previous lecture, in order to receive herd immunity, that is, in order for measles not to be able to get a foothold on the population, you need roughly 95% of the population to be immune to measles, via either having received measles in the past or had a vaccine for it. So 95% is a pretty high bar. Some people, some children are immunocompromised and they cannot actually get the vaccine, or else they'll likely develop complications. So getting to 95% is a pretty high bar, but at various points in our history, we've done that. Right now, it's a little bit lower than that in terms of vaccination. Measles isn't that deadly, of course, but it is still more deadly than not getting measles or than the vaccine itself. At the end of the last century, Andrew Wakefield and several colleagues published a paper in The Lancet where they analyzed the MMR vaccine and behavioral autism. They thought that they had found some connection between MMR and autism, and they hypothesized that it triggered autism. So these are respected members of respected institutions, except for Wakefield, which we'll talk about shortly. The Lancet is one of the top journals in medicine. And this was a hypothesis that caught fire, that made people sit up and take attention, pay attention. We'll talk about that shortly. First, I need to talk about what autism is. So about a century ago, we didn't diagnose autism at all. It wasn't first described until 1938. We probably would have used some terms that are fairly euphemistic and probably a bit offensive, perhaps developmental delay or something like that, to categorize people that we now consider to be on the autism spectrum. There are many, many subtypes of autism. We've recently combined them all to call it an autism spectrum disorder. Typically, they involve problems with social skills, repetitive behavior, or speech and nonverbal communication. They tend to affect more males than females. And it can be pretty bad if you're diagnosed with, well, I mean, if you have autism, whether it's diagnosed or not, people report suffering quite a bit in social situations. We're at the point now where about 1 in 60 people are diagnosed as autistic in this country. So back to measles. Measles outbreaks have started jumping up in the past couple of decades, little by little, but as you can see, there's entire communities that are responsible for some of these big leaps, right? So Amish communities and Orthodox Jewish communities. In Disneyland, let's talk about Disneyland. Disneyland outbreak in 2015, it was 125 cases, largely in California. There were several, it was largely, I don't know who the cause is, but several of the people that were unvaccinated were intentionally unvaccinated. So for whatever reason, they decided that vaccination was too risky, and it led to a little bit of an outbreak. Now, measles, of course, isn't as dangerous as something like Ebola or something else, but it does kill people. And you know, thankfully, not many people have died from measles in the United States. The past couple of decades, and I don't think anyone died from this one. But it does show how a small population of people that are intentionally unvaccinated can lead to an outbreak that affects 100+ families. So back to the Wakefield case. The article was published, and you might be forgiven in 99, 2000, 2001 for thinking that it was a viable scientific hypothesis. But pretty soon thereafter, a scientist involved received some criticism from other scientists that they had focused on a small biased population. They had used incorrect procedures, And anytime anybody tried to reproduce this result, they couldn't get the same results. So it seemed to cast doubt on this big claim that the MMR vaccine caused autism. It was in 2003, several authors retracted their support, and eventually the journal retracted the article entirely. And by 2010, it was revealed that Wakefield had been paid on the order of about $1 million to prove that vaccines were unsafe by a private industry. He eventually lost his license. That actually hasn't stopped the anti-vaccination trajectory. And in fact, if you log into mommy blogs or certain sections of the internet, you will see a lot of people cast doubt on the efficacy of vaccines. And I get it. I mean, I get when you're a parent, a new parent, you're making these big, huge decisions, and it's scary because some of your decisions might have lifetime consequences for your child. They might have really cause really big problems for them. And you're a parent, you don't know any better, and the doctors aren't talking to you. They're not actively doing community outreach the way some of the anti-vax groups are. And the anti-vax groups tend to be very loud and seek new recruits. And so I can get the feeling of a new parent being freaked out about this choice and thinking that it might be safer not to vaccinate their child. Because, even if it's 1 in a million risk, it's still a risk. Paul Offit, who wrote one of our books, has pointed out that if autism really was caused by vaccines, we would have detected it. We've been able to diagnose problems caused by vaccines that are much, much, much rarer. So if autism was in that downstream consequences of any vaccine, it would have been detected a long time ago. And the fact that nobody's been able to reproduce Wakefield's results suggests that at least the MMR vaccine is safe with respect to causing autism. So it turns out that when you ask people about this, people tend to accept that medical scientists know what they're talking about. There do tend to be people that think that, so about a third of the population thinks that parents should be able to decide whether to vaccinate their children or not. There's something troubling about this in that vaccines, you give them because of the hope of building up herd immunity. And so in some diseases, if you get 70% of the population vaccinated, that's enough to build up herd immunity. But in other diseases, you need everybody on board or else it doesn't help. So a good chunk of the population, 30% of all adults, 20% of boomers think that the parents should decide. Younger people tend to be more accepting of anti-vax claims and be willing to live in a world without everybody being vaccinated for certain things. And so we come down to this clash of values, whether the individual freedom to not vaccinate yourself or your child should come into conflict with the health of the people that you interact with, or the health of your child who is too young to make a conscious decision on the matter. And it's a conflict of values that I think the majority of Americans, according to polling data, is on the side of health rather than choice. But it is a question to decide and debate about. As it is, we have a lot of states that have pretty effective vaccination laws, but roughly an equal number of states that are much less effective. And so if you were to watch out for states that might have outbreaks, you might be paying attention to some of these states or to some of the communities that have religious and cultural reasons to not vaccinate, even if it's against the law and strictly enforced. So um, as a whole, I think that there's something a little bit distressing about how Americans have become less confident over time that vaccination is important. It's still the vast majority of Americans believe that vaccination is important, but it has decreased from 19 out of 20 to about 4 out of 5 in some groups. So it's something to keep in mind as we move forward. I imagine all of this is going to drastically change given the coronavirus pandemic, but I think that's going to be the subject of the next video.